You're listening to Health Professional Radio. My name is Wayne Buckler, and today my guest is Associate Professor Dr. Lesley Braun. Lesley joins us from Blackmores, and she's going to have a chat to us about the Institute Symposium, the Blackmores Institute Symposium. So, Lesley, welcome to Health Professional Radio.
Thank you for having me.
Now, I've not heard of Blackmores Institute particularly. I certainly know of Blackmores. Tell us, how does it fit together? How does it work within the Blackmores group?
Okay. Well, Blackmores Institute was started about roughly 3.5 to 4 years ago, and it was set up to be the academic and professional arm of Blackmores. So in other words, we're the non-commercial arm. We really head up all the education and research across the group. And the other thing that we're very much involved with is trying to translate evidence into practice. So we do that through education, through online webinars, through seminars, and also through our upcoming symposium, which will be in Melbourne very soon.
Now, Blackmores, I know, has a footprint that's pretty much global. What's the Institute's geographic footprint? Does it follow the same pattern?
Yes, it does. We're based in Sydney on the Northern Beaches at the head office at Blackmores, and obviously we have our own part of the building there. But really, our Director of Research, for example, is in Lismore. We have educators that are in virtually every Asian country that Blackmores operates in. We also facilitate research through multiple different universities and also support lectureships as well. So we've got excellent relationships and working partnerships with universities such as Sydney University, Monash University, QUT, Griffith University, and it just goes on and on.
Now, those universities that you've just been mentioning there are, world-rated universities. Are you involved in research with them?
Yes, we certainly are. At any given time, we have roughly 40 different academic or research projects ongoing, and very often I get asked by professors of different units who are doing research for us to try and facilitate and support them. So, for example, we were actually approached a little while ago by the Australian Dental Association, who were very keen to do some research with paediatric dentistry. And one of the reasons they approached us is because with Blackmores products, they're very high quality, so it's very easy to get through ethics because of that. But also we really do believe in research and putting back in to try and increase the evidence base. So, in fact, in one of the studies that we're currently trying to support, it's going to be more costly to create the placebo than to provide the active free of charge. But we're prepared to do it because we need to do it. So, we facilitate a lot of research, but we do it very ethically. So our team does not get involved with working on the methodology. Everything needs to be ethics approved. And we really do encourage all the researchers to publish whether they get a positive or a negative result.
Now, Lesley, you mentioned your involvement in research in universities and education. But the question I normally ask at this point is about products and services. Are there other things you do that you haven't mentioned?
Well, we do have a very big education part of what we do. And so we have online modules, so electronic learning. And we actually, last year, supported, would be over 20,000 people using our education services, mainly pharmacy assistants, but also pharmacists and general practitioners, and increasingly we're getting some of our online modules translated into Mandarin and Thai because we have a big demand in Asia for our education as well. So it's one of those things I feel very passionate about because I spent 10 years as an academic doing clinical trials using things like fish oil and coenzyme Q10 in cardiac surgery patients at the Alfred Hospital. And we had some fantastic results. We got published in, good journals. But the thing that really frustrated me was that it didn't really change public health. And people out there in the real world weren't really benefiting from some of these results that were showing good benefits. So I'm feeling very passionate about the need to translate that evidence through education and other various communication methods so the public can benefit.
You're listening to Health Professional Radio. My name is Wayne Buckler and my guest today is Associate Professor Dr. Lesley Braun. Lesley's with Blackmores and we've been talking about the Blackmores Institute and how they fit into the Blackmores group. Lesley, one of the things that we have on Health Professional Radio is a large clinical audience. Probably 95% of our listeners are clinicians of some sort. Is there any takeaway message for them that you'd like them to get as a result of having our chat today?
I think that it's really important for people to recognise that, particularly in Australia, 7 out of 10 people are using complementary medicine products. It's really important for clinicians to understand the benefits as well as the risks of those. But equally, I think it's important for clinicians to understand the evidence-based complementary medicine that would be of benefit to their particular patient group. So, for example, one of the things that does keep me up at night is when, for example, I hear of a friend or a family member that may be going to their GP for a health concern, and instead of being offered something that was safe with evidence that it was a complementary medicine, they're straight away offered a prescription medication which does have risk and side effects. And I just keep thinking this is a lost opportunity to improve public health by starting off with low-risk evidence-based products or treatments before going to the more high-risk type treatments. So I really hope that with more education and people being more informed and clinicians being more informed, it's actually going to improve public health.
Yes, getting that change through health is never an easy task. Now, I understand Blackmores Institute's running a symposium for healthcare professionals in October. Can you tell us more about that?
Sure. It's going to be our biggest one yet. We actually had our first symposium in Australia last year and we were oversubscribed. We actually had to turn people away because the room wasn't big enough. So it really showed us a big demand. This year it's going to be in Melbourne. It's a Pullman Hotel on October 23rd and 24th. And we've got over 12 speakers and we've got a lot of researchers themselves coming to talk about the research they've done with a practical bent. So, for example, we've got Professor Lynn Griffiths, who's coming from QUT, who's going to talk about the randomised trials that she's done with a specific vitamin combination for migraine. And also she's been working on the nutrigenomics of migraine and how genetic profiling can actually help you to predict who's more likely to respond to that treatment or not. So it's really groundbreaking stuff. We've got some other work as well that I think, for example, Professor Andrew Scully is going to talk about curcumin, which is a really popular ingredient. And they've done some double-blind trials with that, looking at it for brain health and for memory and concentration. And so we've got very high-caliber speakers talking about cutting-edge research that can be used in practice really the day afterwards.
Now, we'll make sure on our website we've got the dates and details of that, but just give them to us again so people can make a note if they didn't have their pen in their hand.
Sure. So it's in Melbourne at the Pullman Hotel, Friday the 23rd of October and Saturday the 24th of October.
Now, Lesley, if healthcare professionals want to learn more about the evidence-based herbal and nutritional medicines, where can they go?
There's a number of different places. One of the things that the Blackmores Institute does do is we have a medical editor who writes a weekly research newsletter, which you can sign up for and that comes to your inbox for free every single week. We've also got online modules that are open access that have been put together by universities such as Griffith University, and we've made that open access so everyone can get access to them. There's also a range of resources. So on the Blackmores Institute website, we've got a comprehensive guide to drug-herb interactions, which again is available for free. And that's just been updated by a professor of pharmacy practice from one of the universities. So that's really fresh and very up-to-date and ready to go. So I think you'll find a lot already on the Blackmores Institute website.
Lesley Braun, it sounds like Blackmores Institute is right on top of this. Is there a website where people can just get hold of Blackmores itself?
Well, the Blackmores Institute website is separate to the main Blackmores website.
Right.
It's really the website for healthcare professionals. So you'll find a higher level of more technical scientific information. So Blackmores Institute website is the one to go to and log on in and, have a look around, and I think you'll find a lot of very useful information.
Thank you for your time today, Lesley. It's been lovely having you with us. Your passion is clear when you talk about this.
Look, thank you very much. And I just think that there's so much more we can do to improve public health, and certainly complementary medicine is a big part of that these days.
Very true. Now, if you've just listened to my chat with Lesley Braun from Blackmores, the good news is we have a transcript on our website at www.hbr.fm, and you can hear an archive of the whole interview both on YouTube and on SoundCloud, and there are links to that on our website as well. You're listening to Health Professional Radio. My name is Wayne Buckler.